I've been looking for a house with no walls or no whispers, no hiding places, no secret sister. Been looking for a house that won't shelter a lie, no tear-stained past or reason to cry. I wanna live, live, live in a house of love. I wanna live, live, live in a house of love.
This is Empowering Women Everywhere. I am your host, Nan Gill, and today we have as our guest Angela Johenze of the Orange County Mental Health Association, the Mental Health Association in Orange County.
Correct.
And she is the division director.
Correct.
And she's here to tell us about what are some of the things that the association does and some of the services they provide.
Well, thank you very much, Nan, for inviting me today. As a nonprofit agency in the Orange County, we actually are very proud of the various services and supports that we offer. So I did bring a variety of brochures, but I'm just going to talk about what we actually do that most people are familiar with, and then get into some particulars that most people might need some support with. So Mental Health Association in Orange County actually has 3 distinct areas in which we provide services. First is mental health, everything from housing to case management to support groups to our 24-hour crisis helpline. We also provide...
Now wait a minute. What is the hotline? Tell
Our
us.
24-hour helpline, which is 1-800-832-1200. It's a 24-hour, 7 days a week support line that people refer it as a warm line. So say you're just struggling with life in general, whether it be work, home, school, your community, a neighbor. We actually have individuals that during the day at work through the Mental Health Association that answer the calls. And in evenings, we actually have volunteers that support the line. And what happens is you would call the 1-800 number, again, 1-800-832-1200. Someone would answer and just figure out what's going on. If it's more than just someone to make referrals, so everything from housing referral to someone needing support with, say, their school, or if it gets more significant, for example, the person's in crisis, we can advocate and support them with getting a mental health assessment done, everything from a suicidal caller that just needs someone to determine if they need to go to the hospital. We have the ability to do assessments there. And if it is something significant, we would actually connect them with other services in the community so that they would get immediate support at that moment. Because it is a warm line, it's all confidential. It is a line where we don't leave the agency or our homes when we're volunteering to go to the caller, and that's where we would connect them with someone that could.
Okay, so if someone was having a difficulty, whether it was with housing, whether it was with substance abuse, whether it was a friend of theirs that had a difficulty, they could call just to have someone to speak with.
Correct.
And then it was totally in their hands. It's not like somebody's going to come running over and say, oh, you have to do this.
Correct. We don't tell people what to do. We look at what options they may have.
Right.
We look at their immediate support, whether it be family, friends, community, to see within themselves what kind of psychological influences they have, looking at their own attitudes and beliefs, making sure that we can connect them with an appropriate referral. Because often someone will say, oh, I've heard about that service, and it's almost like taking an onion. You start peeling off the layers in which why someone might not reach out. And for us, we meet them where they're at. Let's find out they might have a pet that's in their home that if they do go to get support or an evaluation, who's going to take care of their pet. So part of that referral process is making sure the person as a whole, all those needs are being met.
Right.
So that they can go and take the time that they need to look after themselves. But let's be clear, Nan, most people that call the line aren't needing to go on for an evaluation. They just need someone to listen to. They might need some referrals to a support group or a therapist in our community. And the nice thing about Mental Health Association is we have all the listings within our resource directory to be able to support those kind of referrals.
Now, when we were talking before, we were talking about women or men that care for their spouses that may have an Alzheimer's. situation that feel isolated and by themselves. And you said that there's support groups that you refer them to.
Correct. Within our agency, we do have family support. We have 2 wonderful women who work for a mental health association. One person, Mary Dumas, works very closely with families who have a child with mental health, and then Peggy Spagnola works with families that have an adult with mental health. So that person can get a personal call from one of our family support women, or we can actually refer them to a support group that might specifically deal with the illness that their loved one suffers from. And what we know that by getting support for ourselves, it makes us stronger to be able to support those around us that might be having a difficult time.
Exactly. It's not an easy thing to be
Not at
the
all.
sole caregiver, whether it's Alzheimer's or whether they're incapacitated, to reach out to a friendly phone call.
Correct.
Yes. And you said you had 2 other areas that you offered?
Correct. And what piggybacks the helpline before I move on is the idea that we have Text for Teens. I'm just going to hold up the card. We're very proud of our Text for Teens program. It was initiated a couple years ago. What we realized is as technology increased or advanced, we had a lot of young people that we felt could benefit from someone providing support, a listener, but what was the likelihood of them using our 24-hour helpline? So the Text for Teens allows young people to actually text in their questions and concerns, things that they might be experiencing at work or home. It's amazing now that we have a lot of young people that go to school full-time and work full-time. So how can we help them navigate just life in general? So we have people, different hours. It's not 24/7, but we do have hours that people are able to text in their issues. So that's really ties into the mental health piece. And the other area we have is developmental disabilities.
Okay.
We have everything from our Medicaid Service Coordination Program, which really provides, again, wraparound services to our individuals with developmental disabilities, helping them navigate everything from case management, their appointments, their housing. We have various support groups as well through Mental Health Association for individuals, whether it be the family member, the sibling. We realize that often we provide support for the individual with a diagnosis, but often they have brothers and sisters that need support as well, just to be able to go and vent and be validated about what their experience is like to be with someone they love dearly at home, but might get a little frustrated.
Now, all these services that you offer, are they free?
All of our services are free when you get into things like the support groups, the referrals. Where some of our programs are driven is through Medicaid billing. So
Okay.
our Medicaid Service Coordination, which is for developmental disabilities, we are one of the agencies in the community that provides care coordination, and that's a wraparound service for people that have basically at this point would have a physical, substance abuse, mental health. They have some type of diagnosis that the state has identified them as individuals that need a little bit more support. Someone that can help them navigate the system to see themselves as a whole. So if it's housing they're struggling with, let's make sure we can navigate with them to either find new housing, discuss issues with their landlord. If it's medical appointments, let's make sure that they get to them, that kind of stuff. So those are driven by Medicaid billing.
Now, you also told me something about a service that you have if someone is homeless.
We actually are part of the Orange County Housing Consortium.
Okay.
And so part of our role within our agency and the community is to look at how better to house individuals that are homeless. And fortunately, some of our programs require the person to be homeless. And as we discussed earlier, we have a lot of caring families and friends that allow people to sleep on their couches, which kind of takes them often out of the actual homeless need for them stating at this point that they would like to get into housing. But we work with them to figure out what's available, whether it be low cost, affordable housing. Would they qualify for a single point of access, which is through the Department of Mental Health, whether or not they could be put on a wait list for housing where they would be connected with an agency like Mental Health Association, where we would support them with part of their actual housing needs. So that's everything from case management, some get a housing stipend, and then we also have through the county, not through Mental Health Association, but we work very closely with the Honor EHG, which is our emergency housing. They actually have a housing first model, and they're looking at housing the most chronically homeless individuals in our community. Really meeting them where they're at. And the Housing First model, which our agency tries to follow the same philosophy with our housing programs, is really, something goes wrong, we're not evicting you. If we have to change landlords, then we will change landlords. We will find you appropriate housing for what your needs are.
Right. Now, what's the Welcome Orange? What's that about?
It's the new initiative that, through the leadership of the Department of Mental Health, we've been working very collectively. Many agencies get together twice a month. One is what we call a steering committee. Those are all the agency leads that come together to look at how do we promote a welcoming environment. So, for example, if someone was to call MHA, Mental Health Association, and we weren't the individual agency that they would provide that service, we would make sure that we connected them with another agency that did.
Right.
We wouldn't just give them a referral. We would say, let me make the call for you.
Oh, okay.
Let me make sure that so-and-so is aware that you're going to be stopping by or that you're going to be calling. Because what research has shown is if I just give you a couple numbers and you write it down incorrectly or you lose it, you're less likely to follow up with that support.
Right.
So we want to make sure that if I am also giving you the wrong referral, which happens, that we want to make sure that we can then say, oh, thanks you for your time. Let's connect you to a more appropriate referral.
Right.
And if someone says to me, we've heard, oh, I've been banned from that service or I can't access that service, well, let's figure out what the barrier is.
Right.
What if I make the call? I can't make promises, but perhaps there's somebody that I can connect you with. And if there is a ban for whatever reason, often it's something that's been stated, and realizing that, for example, emergency departments can't ban people. Let's look at what other supports could be given to you.
Right.
So Welcome Orange is the initiative it's hopefully going to continue throughout Orange County, where we all work together to make sure that at no point someone has a negative experience or gives up on themselves in the care that they deserve and require.
Right. Now, if you know someone or your family member needs help and they're not willing to go, what do you suggest?
If it goes back to the idea of family support, if I have someone that's struggling with even just how to convince someone to get support, encourage them. I can't make any promises when you take anybody anywhere, but we often say to them, like, imagine this was your brother or your sister or someone that you could just pick up and move. How would that work? Would they go with you? And so having that family support person where they can actually talk to them and say, you know what, this is a lived experience for me. I want to be able to work with you to figure out best ways to get that person the help. Like I said, if it's a young person, you almost pick them up, put them in a car, and doesn't make it as welcoming, but you get them where they need to go. When it gets into adults, we want them to be empowered to make decisions for themselves.
Right.
And sometimes it's just having somebody else that's gone through that. So we would refer them to our family support program, and we would also send out as many resources as possible so the person can get a feel for what it would look like, and then let them ask questions as well. But at the end of the day, if that person chooses still not to go, at least the caregiver is getting support at this point.
Right. Okay. So you spoke about the emergency intervention, and then the family support services, right?
Correct.
And what was the third?
So
Program.
we had mental health, we had developmental disabilities, and then we also have crisis services. Now, obviously, the helpline and the text for teens falls under that, but we also have our rape crisis program. We're the only rape crisis program in Orange County, and they provide a variety of services, everything from going into schools to doing health fairs to notify people what would be consisting of rape kit. So we do have sexual assault nurse examiners as
Right.
part of that program, and they are able to go into 2 of our hospitals, so Orange Regional Medical Center as well as St. Luke's. They actually go in and provide individual care to this individual who's unfortunately been sexually assaulted. They go through the kit with them, and they're also assigned a advocate. An advocate would meet them at any hospital, but what I'm getting at with the sexual assault nurse examiner program is that would be a trained registered nurse who's gone through the 40 hours of training plus the competency to be able to do the thorough rape kit that would then be either kept in the hospital for a certain period of time or handed over to the local police department to be able to send off the results to find out, collect the evidence that was collected. Their rape crisis program is 24/7. So as I mentioned, they can take a call. So for example, say I was sexually assaulted within the last 24 hours, we would recommend that person make the call to the 24-hour helpline. Again, 1-800-832-1200. They would be connected with our rape crisis program. That person would go over all their options with them. So everything from meeting them at the hospital to have the rape kit completed. They would go over next steps, what will happen if they give it to the police. They can actually go with them to the police department. If they end up having a trial, they'll actually go and advocate with them at the trial as well, so that at no point this person is having to go through this very difficult crisis of their own by themselves.
Now, as far as the crisis, when that happens, is there any support as far as intervention with them besides, getting the evidence and whatnot? Because I imagine that would be very, very, trying for a person to go through that.
Definitely a traumatic situation for anyone to have to go through that. And as I mentioned, the advocate, someone might say, you know what, I don't want to have a kit. I don't want to have an exam done. And that's okay. So they can actually meet with the Rape Crisis Program. They can go over all their options. They can be connected with a therapist in our community that is there to assist them through this difficult time. The idea is, what services is available for this person? What can I recommend that they get connected with, so that down the road they might decide things differently? So for example, if hypothetically I go for a rape kit and I get it done and I decide not to, which is my choice, to have it not handed over to the police. Because I went to the actual emergency department and had the kit done, everything is documented, so that if 10 years from now, 15 years from now, I'm still struggling, I would have worked with the advocate to fill out the Crime Victims Board. It's a packet of information that says, this was the date and time of my assault, this is where I went, what took place. It's all now documented so that I can actually be given support based on my assault, that there shouldn't be a cost associated with me being sexually assaulted. So the kit is done free through the hospital. We get reimbursed. The hospital, as well as the program, gets reimbursed from OBS. And what happens is we also fill out the paperwork so that whatever other supports they need, anything from counseling, if they had to leave behind their clothing because of the fact that it's part of the evidence collection, that would be replaced as well. So it's really for them to realize that this should never have happened, but now that it has, what kind of supports can we put in place for you?
Right. You're a parent, and your child is demonstrating possible suicidal tendencies or something like that. You can call the hotline.
Yes, please. We would want parents to call. And what's interesting is, quite often, and I'm not telling parents how to parent, but what happens often is, if I'm grounded or something goes wrong, they take away the person's cell phone. And that takes away their ability to potentially text. It could be something that's happening in school, relationship. It's amazing the amount of young people that are in relationships at a very young age that aren't necessarily positive. So whether it be the helpline or whether it be the text line for individuals to be able to text their questions and concerns. Parents, no question, is beyond what we would want someone to reach out to, but we also want people to realize, just because your child has said or done something does not mean that they're suicidal, obviously, and it doesn't mean they have to be hospitalized or sent for an evaluation. Just the call itself can be very supportive in saying, this is what I read, this is what I saw, these are next steps. Look at our schools. They all have had the opportunity to either have staff trained to do train the trainer for suicide assessments and interventions and prevention. And we also have community members that go into communities on an annual basis to be able to give whatever support possible. Everything from bus drivers to cafeteria staff, wherever we can be invited to go, we go, because kids say a lot of things, everything from, if I don't get an A, I'm going to kill myself. Well, let's question that. What's the likelihood? Versus someone saying, you know what, you don't have to worry about me anymore. I'm not going to be here tomorrow. What are we going to be? Just being comfortable asking those questions. We try to create an environment throughout the entire county that at any point someone wants to get more suicide prevention information, that we're going to hook them up to one of our ongoing free trainings so that they can prepare themselves. But as I mentioned, our schools have done an excellent job with making sure that their staff and students are trained. And typically when we go in to do a training, we also do it at the PTA. So the parents see the same message, and the students see the same message, and the teachers see the same message, so that if there's any change in someone's behavior, we can actually intervene immediately and not wait for them to feel like they're they're not as bad as they were, or their friends said that they'll help them. Like, this is not the time we want people to say, oh, I got this. One of the things that they found that is common among a lot of individuals that have those thoughts of suicide is hopelessness. So how can we put the seed of hope back into someone's life?
Right.
You know, it's something as simple as most of us had someone say, good morning, hi, how are you? And there's some people that actually say by the end of the day, they actually had nobody say good morning or hi, how are you? And that probably eats at a person over a certain period of time.
Right.
Like, you know, am I invisible? What do I need to do to be seen? And we really want people to know that call the 24-hour helpline. We want to listen to you. We want to be able to talk to you. We want to be able to support you.
Yeah.
And if you look at the loss of someone's life, just even bereavement, you know, loss of loved one. And as you mentioned, the idea of someone with a family member that has Alzheimer's. They're still alive, but the person they knew, that the person that's in front of them is so different at this point. And how do you embrace what the new person is? And keep those memories of the person that they love, still love.
And plus the actual amount of work involved in caring for someone that's incapacitated.
Correct. And that can't be easy. And you look at the costs, and, you know, we joke about boomerang, how kids go to college or university and come back, and, you know, people moving in with their families. There's a lot of people that don't have that option. You know, as much as people say, oh, my kids live at home now, some love it. You know, some wish things could be better for their family members, but there are some people in our community that literally, if you ask them who's there to support you, who could be at your rescue immediately,
Right.
often they struggle with finding someone. And so we work with them to figure out what that would look like. What would your support network be?
Right, exactly.
And that's what one of our you know, tasks of the helpline, our support groups, our referrals is to, like, for example, one of the great programs we have is Comp Here. And that's someone, we actually have a couple staff that go out and meet with individuals that don't have a lot of social support. And it might be anything from grocery shopping to doing your laundry with them, just that person that can connect with them. Might be driving them someplace that they like to go, so the animal shelter,
Right.
you know, doing their volunteer work. It's that person that says, I don't really have family members that can do this with me.
Right.
So it's that kind of support that they do. Because we have shifted with managed care. The idea of from case management to care coordination is we really want to coordinate
It's
a person's
huge.
care. It's huge. And so a lot of times things that individuals might have been used to doing, they don't necessarily get that anymore, because when you have lots of people to service, we don't want anybody to ever feel like they're being put into a pool of hundreds and hundreds of people. But the idea is, who else can I connect you with? And so to me, that's a huge shift. We don't want anybody to feel like we're taking on new people to replace that person.
Right.
It's just the nature of it is who's in your corner? Who can I connect you with that you have even more support? So if somebody can get 5, 6 different services, how wonderful.
Yes.
You know, let's tap into whatever you're entitled to. And often people say, no, I don't need it as much as somebody else. And we say, no, if you're entitled to it, let's figure out how to make that work.
Okay, which leads us to, as far as, do you have opportunities for people that want to get involved and make a difference?
We do. We have always volunteer opportunities. And if you go to our website, which is www.mhaorangeny.com, we have a whole section for volunteer opportunities. But really, our key areas is our helpline. As I mentioned earlier, during the day, we actually have all of our staff are required as part of their contract to do an hour each week. And then we have volunteers and staff that do it in the evenings and weekends. So we always take on volunteers for that. That would be someone that would be put through a significant, you know, crisis intervention, look at practical assistance, emotional support, referrals to community. We also, through our rape crisis program, we look for people that can go to the hospitals and advocate
Right.
for the individuals that have been sexually assaulted. We also have through our psychosocial club, which is Hudson House and is located in Newburgh. They actually have a day program where we bring volunteers in to help support the peer-run groups. And
What's the Peer 1 group?
A peer-run group is where we have members that meet the criteria of having a mental health diagnosis. They actually come to program Monday through Friday, and they get involved with everything from helping us cook because we provide meals for people that are members. Everything from cooking the meals to planning groups to planning activities. So part of the peer run piece is that the groups are designed by the members, the groups are approved by the members, so that we're including into our daily schedules what they're interested in doing. So there's everything from budgeting to vocational if they're looking for a job. We have someone that works on housing, substance abuse, mental health, how to advocate for yourself, and then everything from fun things like up and moving, going for walks, learning how to navigate the bus system, bingo. I mean, some fundamentals of going out during the day. But why we do this, when you look at the Psychosocial Club, is for some people, just getting up out of bed and going to program is a success.
Right.
So there's no requirement that you have to be involved with every single group every single day. But let's us check in with them. It seems like you are a little sleepy today. Is it your meds? When was your last appointment?
Right.
So it allows us another opportunity as a community to check in. But they're just such a delight to work with because, like I said, they inject so many good ideas. And they're the first ones to say, hey, the other day a young woman said to me, I'd like to change what we have for breakfast. And I said, well, what would you like? And she goes, I would like to have pancakes and bacon. I said, I would like that too, but let's see what we're really having. So they were having oatmeal and I think a banana, and so it wasn't as exciting, but it's the idea, let's have pancakes and bacon. How can we make that happen? If that's going to make someone smile one day, and then what we do with that, back to the peer run piece, is this is the day we're going to do it.
Right.
You're going to help me cook it.
Right. Okay.
So it's that involvement. How do we connect them? So there's those activities. Then we have other programs that often have events. So for example, we have what they call the Hercules Challenge. It's going to be the first one in Orange County. And if I remember correctly, it's the Orange Regional Medical Corporation investment group that's helping us put together this Hercules Club or Challenge October 3rd, and actually proceeds are going to Mental Health Association.
Okay.
We also have the Autism Move-a-thon, which is a huge initiative in Orange County, and they always bring on volunteers to help with their annual events. And the one that's most known at the Thomas Bull Memorial Park, which is coming up in October, which I believe is October 10th. And it is actually October 11th, Sunday, October 11th. That brings on a lot of volunteers. So what I'm getting at, Nan, is there's some that volunteer on a regular basis.
Right.
As I mentioned, I started in 04 as a volunteer, 40 hours a week. And then I moved into, 10, 16 hours a week just because of working full time. There's people that work and then volunteer for a particular event, or they actually volunteer on a regular basis. So the best idea is to call our main number, which is 845-342-2400, and ask to speak with someone that can talk about volunteer opportunities.
Okay. And now I'd like to ask you the mission.
The mission, okay, so Mental Health Association seeks to promote the positive mental health and emotional well-being of Orange County residents, working towards reducing the stigma of mental illness, developmental disabilities, and providing support to victims of sexual assault and other crimes. In partnership with service recipients, families, volunteers, and the community, MHA strives to fulfill its mission through culturally competent advocacy, direct services, public education, and responsiveness in times of community emergency.
So, be sure to call whenever you need help or if you want to help. And the number to call?
1-800-832-1200.
And this is Nan Gill with
Angela Johenze.
And we're very happy to have you with us at empoweringwomeneverywhere.tv, and follow us at Empower Women TV. Thank you.
Thank you.